Hello everyone, this is Adam Stewart from stewartmedicine.com. This is just a follow-up video to build upon the concept of cardiovascular risk assessment, and this video is going to focus on informed decision making. So there are guidelines that say if a person is high risk for having a heart attack or stroke, that person should maybe be on a cholesterol pill or a statin to reduce the risk. But these are just guidelines, and it's up to the individual patient to make the decision that is right for him or her. So if we take an example of this patient here, say 60 years of age, male, non-smoker, non-diabetic, and with these blood pressure and cholesterol readings, and no family history, we come up with a calculation that this patient is at about a 21% risk of having a heart attack or stroke in the next 10 years, which would be deemed high risk. Now, the guidelines would suggest that this patient should be on a statin in order to reduce their risk. That might be right for some people, but it might not be right for everyone. So what I like to do is work out a patient's individual risk and then have the patient know the pros and the cons of going on a cholesterol pill, and then that person can make the decision that's right for him or her. So let's take this patient for example. So we already know that the high risk, by high risk, they should be recommended a high dose statin. So if we click on this, we can see that the patient's risk drops when they're on the cholesterol pill. So here again are the 100 smiley faces, and if we took 100 of these patients and put them on a high dose cholesterol pill for 10 years, it would save 7% or 7 out of 100 of these patients from having a heart attack or stroke. Now, some patients look at that and they say, yeah, sign me up. I'll do whatever it takes. I'll take a pill to reduce my risk by 7%. That's pretty good odds. Whereas other patients might look at that and think, geez, that's a lot of people taking a pill every single day for 10 years where it didn't do any benefit for the remaining 93% of the patients. So all these blue faces up here were fine regardless. They took a pill and didn't get any benefit. And all of the red faces down here, they all took a pill, but they still ended up having a heart attack or stroke. So it really depends on how you look at it. And depending on the individual patient, one patient might look at this data and decide to take a cholesterol pill, and another patient will decide not to. And either is fine, but again, as long as we've had that discussion and the patient knows his or her risks versus benefits, then that's the best care we can offer.